Hello, everyone. Welcome to the Allied Health event. It is with Medical Outreach Club and the Health and Medical Science Club. We've collaborated together to bring this event to you guys. I'm Shania, and I am the Vice President of Medical Outreach Club, and I am going to be your host for today's event. And yeah, so we're just gonna go through a couple rules and disclaimers before the boring stuff. Okay, so please be respectful of officers and guest speakers who are speaking and just during these meetings. So mute yourself, use appropriate language in the call and the chat, and just be polite to everyone, be cyber responsible. And then any disruptions or members who do not obey these rules, you will be kicked out. Isabel will not hesitate to do so. And just know that this meeting is being recorded. So if you're not comfortable being recorded, go ahead and turn your cameras off and it will be posted on our YouTube channel. So, okay, next slide. Okay, so just to debrief today's event. So we have two sessions. So we have a main session where I will be asking our amazing panelists 6 main questions. And then we're gonna get into, and then after that, we're gonna separate the panelists into 3 breakout rooms. So Mrs. Patti Chan is going to be in breakout room 1, Dave is gonna be in breakout room 2, and Andrew's gonna be in breakout room 3. And that's where you can ask like your specific nitty-gritty questions. And this will not be recorded, and just know that it will be moderated. So if you have any questions, just ask it in the chat. The main session should be about hopefully like an hour or under an hour. And then the Q&A session should be just about 30 minutes, or as long as the panelists would like. Okay, next.
And we just want to remind all our attendees to rename yourself so that you have the number first of the breakout room that you want to be in. And then have your first and last name so that we can organize yourself into the breakout, appropriate breakout.
Yep. Okay, so go ahead and scan this QR code, and it's going to lead you to this, like there's a worksheet where you can take notes, and we have all the questions that we will be asking. There's also like program materials, and so like a couple of the panelists provided like a quick like information sheet, so that's where you'll have access to all that. So go ahead and scan that if you want to get, you can just leave it for like maybe 10 seconds, and then
And this actually Linktree QR code also has information on everything for MOA, and within the program document, there's also information on how to be part of MOA and HAMS if you guys are also interested in that.
thank you. Okay, so there's some extra credit for medical outreach members. So if you screenshot yourself at this event and you just submit it through this Google form, which is the QR code on the right, then you can get extra points for being here, and you could get maybe merch or some special prize in the end of the year if you have a lot of points. So just to keep up that participation. Okay. All right, so these are our panelists. So we have Patti, who is the dental hygiene instructor or director of the dental hygiene program at Foothill. And we have Andrew Trinh, who is the who graduated from the medical assisting program at DeAnza. And then we have Dave Huseman, who is a EMT instructor and also teaches the paramedic classes. So we're going to get started with our very first question. And Patti, if you want to answer, it's going to go in the order of Patti, then Andrew, and then Dave. And so go ahead. So the first question is, please introduce yourself and just let us know, why did you choose your profession and your career?
Well, thank you very much. Hi, everyone. It's nice to have you here this afternoon, and thanks for inviting me to be part of the panel. I'm as Shania mentioned, I'm the director of the dental hygiene program. I've been doing that for the last year. I've been teaching at Foothill since 1992, and I taught in the dental hygiene program, and I did that for quite a few years part-time while I was working as a dental hygienist. And then in 2014, I was hired full-time as the clinic coordinator. So I've been teaching, you know, lots and lots of different courses in the hygiene program for all these years. And, you know, I've enjoyed every minute of it. It's a lot of work, but it's very rewarding. So it's funny thinking about why I just chose to go into dentistry. I don't remember when I had the first conscious thought that I wanted to go into dentistry, but as a kid, I always liked going to the dentist. I never had any bad experiences there. And I had a dental hygienist when I was a kid who I really thought she was super. She was so nice and she was helpful, and she really had a big impact on me. And I liked, you know, how she interacted with other people in the office, and it was just a good experience. And so I think in middle school is when I kind of thought more about what I wanted to do. And for a while, I wanted to be an orthodontist. I never went to an orthodontist myself. I don't know why I chose that, but I realized, though, after a couple of years of thinking about it in high school, that I didn't want to be a dentist because I didn't want to have to run my own practice. I wanted to do something in the dental field where I didn't have to worry about being an employer. And so I started looking into dental hygiene, remembering the hygienist that I worked with that I was exposed to as a child. And so then I looked more into dental hygiene and thought, well, it's really good pay, it's very flexible hours, and it works well if I had decided to have, you know, a family. You know, I could kind of choose the days that I wanted to work. And so that kind of transitioned in high school. And so from that point on, then I worked towards getting my degree in dental hygiene. I worked also after school in high school for my family dentist. And that also helped me to kind of solidify that decision, because I really liked the atmosphere in the dental office and helping people and, you know, working as a team. And so those are really important parts of being in dental hygiene. So I'm really glad that I chose the career, and I feel like I've had a very positive experience.
It's great to hear. And then our next. Dave, do you want to answer the next question too, on introducing yourself and why you chose your profession and your career?
Sure. My name is Dave Huseman, and I have been involved in the EMS profession for about 40 years. And my career path, as I was trying to figure out what I wanted to do, was I had a desire to help people. And there's lots of professions where you can help people, but I was looking for something that was different every single day, and always kept you on your toes. I love challenges, especially challenges that are kind of a spontaneous challenge. And it just became exciting to me. And I also got more excited as TV shows that were kind of representing these different types of careers. And during my time, there was a television show that was called Emergency. And it was a very, very exciting show. It dealt with 2 Los Angeles County firefighters, and it spearheaded me into that profession because it was everything that I desired. And of course, you know, at the age I was, you know, I didn't take into account, well, this is Hollywood. There's probably some glamour that's been added to the TV show. But as I got into the profession, and, you know, I was working on an ambulance, and I would go to these calls, and I was watching my partner and other members that would be part of this call of somebody's, you know, unfortunate distress that they were dealing with. And it just made me more excited to want to learn. And then as I got mentored, and I went through training that was very basic back in those days, the state actually didn't have much involvement in what you had to have in regards to your training. And this is like in 1975. And then very quickly, the state's EMS system was catapulted into a much more common ground to what most people are familiar with today. So I got my emergency medical technician while I was working on an ambulance. And then I did that for about a year. And I was very fortunate because I was working in Contra Costa County, and there weren't any paramedics in Northern California at that time. Los Angeles and the Southern California area was really rapidly moving into paramedicine, and primarily because of that TV show. So I was fortunate in Contra Costa County that Stanford at the time had one of the best well-known paramedic programs. Los Angeles area also had a school that was very well known. So it was primarily these two schools that were best in the state to get your paramedic training. And I was part of a lottery system in Contra Costa, and I was chosen along with 29 other individuals to take part in this training. So the training is much different today than it was then. I went to school 5 days a week, 8 hours a day, for basically 9 months. And I learned a tremendous amount of information. I had no idea, you know, kind of like when you're going to school, you're learning so much and you have no idea, like, how am I going to use this? When am I going to use this? Why do I have to know this stuff? But because I was really excited about the profession, that it just kept me wanting to learn. And as I got more involved in the career, I loved every aspect about it. It was there's something about being involved in somebody's crisis and helping them work through it, watching the joy on their face. And not every situation, you know, is a positive situation, but still you're a part of the emotions of a person or a family. And it just inspired me to want to be better and better at what I did. And then I got on with San Jose Fire. I did about 28 years there as a firefighter paramedic. And during that time, I got really interested in helping out at ENT programs at the community colleges. And as I learned how to teach, I got my AS degree. I became more excited about teaching what I knew. And that transpired into being asked to come to Foothill and help teach at their EMT program. And my life has changed over the years that I've been at Foothill. I mean, you're kind of like Patti. You start off teaching part-time, and then during my part-time there, I was asked, hey, why don't you help and you know, maybe be a program director? You have no idea what any of that means, but anyway, you take the steps. And so I was the program director for about 8 years, recently stepped down to a retirement phase, and I will eventually go back and teach part-time because I love teaching. I love being part of the students' learning process. And you know, I'm sure any of us on the panel can attest to this, is that when you run across the paths of the students that you've been involved in and you hear what they're doing, it just makes you feel good that that you're doing the right thing. You know, that your love for the profession, your love for students getting excited about those professions we're all in, and then seeing what they've done with it. I mean, I've talked to people who become physicians, nurses. I mean, it's just, I'm really blessed to be part of this. And it all started from an interest, a TV show that has just spiraled in a right direction for me. And then coming across people that instructors and students and other faculty members, and you're all in it for the same reason. And there's not a greater family to be part of in that education realm. I mean, I love it today.
Wow, thank you, Dave. Andrew, take it away.
Hello, guys and girls. My name is Andrew Trinh. I am a certified medical assistant that graduated from DeAnza in 2019. And I have about 2 years of experience in medical field so far. And I still strive for more knowledge, and it's pretty fun. I worked at the Patti Walter Medical Foundation as part of Sutter Health Clinics. And now, as of now, I've been currently working at the Kaiser Permanente as a CMA and a part-time CNA to just build up my career as a registered nurse. Why I chose the program or just chose the profession is kind of weird. I was confused at the time about what I want to do for the first 2 years in college. I was sort of lost. I went from wanting to be an architect and wanting to be a professor, but I just didn't see it that it fit me in any sort of way. But I did find out about the DeAnza medical program, and I just kind of went from there. I chose my profession because it allowed me to have a stepping stone to become a nurse, and it was the best choice I made because the clinical aspect was really fun and amazing. And I'm really not into needles, right? Anything with that procedure. It was sort of scary at the same time, but it felt promising. But I believe there were some great aspects and skill sets that I can use in the future as well. But ever since I got into a medical setting in the program, I just feel that my introvert self became an extrovert because you have to be a people person in as a medical assistant, and that the DeAnza program does prepare students for employment as a clinical or administrative in any doctor's office or hospital that I can agree of. I mean, I did try with the Unitech students. I also talked to them, and they switched over to DeAnza instead because they told me that other programs that they've been to aren't flexible and they don't really teach you a lot. But who am I to say? I'm just a former student from a medical assistant from DeAnza.
Oh, that's really cool. I can see like as all you guys are talking about your journey and how you got to where you guys are, there's like this certain passion that I can see, and I'm sure that everyone else in the audience can see it. And like there's like a certain enthusiasm that you guys have for your profession, and that's just like amazing. And so I guess this goes into like the second question. It kind of ties into the first. If you guys can just give us a little bit more detail on what's a day in your life like in your profession. Starting with Patti.
Dental hygiene is all about being organized and being prepared. The profession itself has evolved a lot since I started. I graduated in 1986 with my bachelor's in dental hygiene and started working as a hygienist, within a few months of graduating. And at that time, a typical schedule for a hygienist was to see 10 patients in a day, one patient every 45 minutes. Over the years, that's evolved to, of course, now during COVID, it's very different. But prior to COVID, a typical day for a hygienist was you saw 8 patients a day for an hour each, because the emphasis being placed on, the connection between your oral health and your overall systemic health has become much more apparent. Obviously, your mouth is connected to the rest, your head is connected to the rest of your body. So what happens in your body is going to affect what's happening in your mouth and vice versa. So over the course of my career as a clinical dental hygienist, that's definitely changed. And the emphasis is being placed even more on prevention and education. And so that knowledge, like Dave had mentioned, it's like you're learning all this stuff and you're going, why do I need to know this? But, eventually once you're in practice and you're working, you realize that all that information is important, and that foundation that you're learning, that scientific or clinical foundation that you're building while you're in school, is really important to continue to build on as, being a lifelong learner, which is what we emphasize in our program and in all the allied health programs. So, my typical day when I was working as a hygienist, I would get to the office an hour early because I wanted to be prepared and organized for my patients, because I wanted to make sure that I could give each patient the care that they needed, but also be ready for the patient that would be waiting for me after I was finished, right? So you have a patient at 8 o'clock and I'd have a patient at 9. And so I wanted to make sure that I could easily transition from one patient to the next and not keep people waiting. And of course, emergencies happen and things, schedules get kind of thrown out of whack, but that was my and most hygienists do the same thing. You get to work early, you set up your instruments and get all of your tools ready. And, say for that patient, you need to do assessment procedures, oral cancer screenings, patient education, the actual cleaning of your teeth. That's a very small part of that whole hour appointment that I have. You have to take dental x-rays, have to do an examination of not just their soft tissue, but their hard tissue, their teeth as well, their gingival tissues, gum tissues, and then also have time to build a personal relationship with your patient. So by being able to connect with them so that you can help them achieve better health and build a trust between the two of you. And so there's a lot of things that you have to pack into that 60 minutes that you have. And then you repeat it again for the next patient. And so it's very tiring, and hygiene is a very physical job. Sitting there, bending, craning your neck. It's hard on your back. It's hard on your neck. It's your shoulders. I have hygiene friends. One who taught for many years at Foothill, she had to have her shoulder replaced. She had her elbow replaced. And it was all work-related injuries that she had as a hygienist. So, just know that hygiene is not just sitting around on a chair all day and scraping teeth for a few minutes. It's a very physically taxing and mentally taxing job, because most people don't like to come, there's a majority of people that don't like to come to the dentist, and they're scared to come to the dentist. And so you're trying to help them overcome their anxiety as well. So there's, that general psychology and classes that you took, that also comes into play in being in the dental field. But it's really great working with the other people in the practice, building a team rapport and helping each other. And, I have some of the best friends that I have come through working with them in the dental field. So it's busy. I don't know if that gives you enough of a picture, but I don't want to spend too much time, because I know the other panelists want to say something, but that's kind of the overview of what we do.
Oh, wow. I was not aware about the how much your posture can get strained. And so I did not think about that, but thank you so much for giving that insight. That was a very interesting piece of information. Dave, go ahead, take it away.
So before I talk about the day in the life of an emergency responder, I just will add to what Patti was saying. Was a good friend of mine actually, while at the dentist having their teeth cleaned, had these complaints that were unrelated to their mouth. And as they kind of looked into it, between the dental hygienist and the dentist, they made a determination that this person should be taken to the hospital. And so 911 was called, and sure enough, the guy ended up having a heart attack for some things that probably would not have been, picked up, because he was not really putting any emphasis on it. He just thought, I'm just having these aches or pains or whatever. And because the dentist and the hygienist, who he respected, took it to a different level of concern. Anyway, so he went to the hospital, and sure enough, and he survived. But kind of, what Patti was saying is that they do play an important part. I will also add is that the hygienist that I've had, who it's kind of a bittersweet relationship, because she's probably one of the more annoying people that I have to interact with, but because I don't always put enough emphasis on my dental hygiene, and I always do a great job before I go to the dentist, but but it's because of her that I end up doing the things I need to do, even though every time I go, I expect I'm going to get, I'm calling it a lecture of what I need to be doing better. But, you know, you need people in your life to kind of keep you on the right track. And I know that she's doing it for the right reason. So anyway, I have a great respect for dental hygienists. And I am one of those that breaks out into a sweat prior to going to the dentist. It usually involves pain, and I'm not a big proponent of it. But anyway, the day in the life of a first responder can really be quite different depending on what area of EMS you get into, because with your EMT or paramedic training, I mean, you could work in a hospital, you can work on an ambulance, you can get a job in the fire department. You know, my counterpart, who's going to be part of our discussion in the breakout room, Nadine, who's part of search and rescue. So those are non-paid positions, but they get involved in a lot of different situations when regarding EMS. So, you know, you can work at amusement parks. So it's so vast. And so to kind of find some commonality in all of that, the common role is that you can have moments of not much going on to moments of complete chaos. So if you are, you know, on an ambulance, you might be at a station, you might be driving through the city, and then a call comes in, you have no idea of all the particulars about the call, you get a little bit of information. So you're walking into the door of really nothing more than, I'm not feeling well, I have a cough, my head hurts, and that might not even be the right reason. So this is where your training as an EMT, as a paramedic, where you are going to evaluate that person from head to toe and see what lines up, help the patient make decisions on whether they should go, whether if the patient doesn't want to go. And that's what I loved about the profession. I mean, I haven't been working in the field for quite a while because I've kind of shifted over to education. But, you know, it's the same thing with like search and rescue. We're going to talk about that a little bit later on. Again, you're doing your everyday kind of routine at some job, and all of a sudden an alarm will go off. You'll mobilize to some location, and now you're going out to look for somebody to help them, you know? And I think that's what I really like about these kinds of professions, that you have no idea what you're getting into, and it keeps you on your toes. It keeps you wanting to learn more, because like a lot of these health professions, the information is constantly changing. What I learned when I first became an EMT, what Patti learned as a new dental hygienist, what she now teaches is probably like steps above. And I'm in awe of some of our students that have to come through and what they had to learn. I mean, 200 different home medications. I didn't have to learn 200 different home medications. The way I learned about home medications was going to a patient's house and going, hey, what's this medicine for? And then they tell me, and that's how I learned about it. So, you know, like Patti also mentioned, I believe the people that are in these professions are humble individuals for the most part, and they love that profession. So even though your shift might start at 8 o'clock, you're going to show up at like 7:15, 7:30, so that one, you can check out the equipment. Your equipment has to be ready to go at 8 o'clock. You got to make sure you have enough oxygen. You got to make sure you have enough bandages. You got to make sure that the ambulance, the fire engine it's clean, right? You want to make sure a gurney is going to work. you got to make sure your head is in the right spot. You're physically and mentally ready to go. And, you know, and you cared about the people that you were changing shifts with. So if you got everything checked out, you'd say, hey, we're ready to go if you guys want to go ahead and get off duty a little bit early, because, you know, because emergency is the key word here in this profession. So none of this stuff is planned. So if I show up at 7:30, I've checked out the ambulance, I'm ready to go, and a call comes in, I feel I can help that other crew by getting them off early so that they don't have to go on that next call, which could literally run an hour to an hour and a half. Now they're not getting home, they're missing some activity with the family. And so it's like some of my best friends are folks that work in the profession, similar to what, you know, Patti talked about, is that you all know what you went through to get where you're at. You all know the behind the scene kind of information that makes that profession challenging, both physically, mentally on the responder, because you're involved in a lot of different emotions, and some emotions you're not even prepared to deal with. And you know, you work through that stuff. You have your friends that are in the profession that you can talk to that kind of help you with how to work through calls that maybe are not real happy calls to deal with. But all that said, I wouldn't give it up. I don't look back and go, gosh, I wish I'd gone in that profession. As tough as it was for me, the education piece of it, the types of calls that we would go on, I still wouldn't trade it for anything.
That's very inspirational. Wow. Andrew, go ahead and take it away.
Thank you. So as a medical assistant, there are duties that vary from clinics to hospitals. I'm going to tell you both of them anyway, but morning consists of a lot of things. Morning consists of preparing for equipments, checking everything is in stock, making sure the correct patients are scheduled on that day as well, and printing out a lot of like papers for the doctors or the nurse practitioners or PAs. And closing will consist of a lot of cleaning, especially during COVID. I would have to wipe everything down, make sure everything is good and ready for the morning class for tomorrow. And there's also a lot of administrative duties that some people don't realize, as using computer applications such as like the electronic health records program, and in a hospital setting, we use more of Epic. You do answer a lot of telephone calls and a lot of updating, filing a lot of patients' medical records, and scheduling appointments via voice chat or video chat, depending on where you are. But I think the clinic duties overweighs the administrative duties, and that's a lot of injections. So if you're scared of needles, I mean, I'm still afraid of needles, to be honest. I'm afraid of receiving needles, but I believe it's easier giving injections than receiving them. So you also have to explain a lot of treatments, procedures to patients, preparing a lot of patients for examinations, and collecting and preparing a lot of laboratory specimens, and also doing them as well as like UTIs, strep throat, the flu. I don't do much as COVID, but you're allowed to do some COVID testing as well. And what else? Also, you can instruct patients about their medication and special diets. And you can also draw blood. Drawing blood is an option from all my perspective from the settings. In the clinic, they require you to know how to draw blood. Not per se to have like a license to draw blood, but in a hospital setting, you need a license as a phlebotomist, which you'll be going through in the program in order to draw blood, which is fascinating in my perspective, especially the butterfly needle. It looks beautiful. But also in a hospital setting, you'll be taking a lot of electrocardiograms, EKGs. Those are fun. And also a lot of chief complaints, which can be a little stressful at times because you are on the time on the clock, and some doctors want it really early. So sometimes you have to cut through what the patients are saying, but you don't want to be rude. But it is a fun experience in the profession so far. And for my past 2 years, I believe that I don't regret going to the medical field. It is super fun. Sometimes it gets a little stressful, a little hectic, but different careers and different paths. Sometimes you just have it just really depends on where you are, to be honest. In the hospital, I feel like it's a little more stressful in the clinics, but in the clinics, you don't do less work. You just sometimes I believe people can slack off in the clinics because they think it's a clinic setting, but in a hospital and clinics, I believe they're both equally the same workload.
That's pretty cool.
Yeah.
Wait, Andrew, if I may ask a clarification question. So like, don't medical assistants, do they like specialize? Can they specialize in certain clinics too? Like, are you at a specific clinic or is it just like a?
I've been working, I've worked at an emergency clinic.
Yeah.
So you can specialize in different clinics depending on where you want to be. I believe in emergency care, urgent care, I'm sorry, was it urgent care clinic? There's more things that you have to do at a certain time because we have a lot of patients. I believe in a day, we see at least up to 80 patients, maybe hundreds, because it's just, I believe doing chief complaints, they require me to do it within 3 minutes. And I believe that's a little too fast. But sometimes when I was in a medical program, they require me to do in 5 minutes. So in the urgent care, it was between 2 to 3 minutes. So you have to get it like real fast and just there then. And doing procedures, you gotta do it fast as well. But to answer your questions, yes, you can specialize in different clinics. Yes.
That's pretty cool. Okay, so going into the next question, if we can just keep this one like as short as possible, maybe just like under a minute, just like what's the starting salary and is it hard to get a job?
So hygiene is one of the fastest growing professions right now in the United States. And in California, they project by over the next like 10 years, there'll be 17,000 new jobs added for dental hygiene. So, and our students who graduate from dental hygiene from our program, they find work without a problem. And that's full-time or part-time work or even temporary work. It's whatever, some don't always want a permanent job right away. They want to just temp in some offices to kind of figure out what they want. Starting salary here in the Bay Area is quite good. Anywhere from 75,000 to 100,000 a year. And usually hygienists are paid per day. So it could range like $60 an hour and up. Usually per day would be anywhere from $450 up as well. So $450 a day, if not more. So it's a well-paying position.
Oh, that sounds so good. All right, Dave.
Yeah, so like I mentioned before about the different places that you can work as an EMT or a paramedic, I will say, just kind of kicking it off, is that EMR, although it's a training that we do offer, and there are places that you can utilize EMR within California, it's not a level of certification that's recognized by the state. So you wouldn't be able to get a job on an ambulance, but working as an EMT, again, that pay is going to vary. So if you're working on an ambulance that is doing what they call interfacility transport, these are non-emergency transports, or are you working on a 911 ambulance as an EMT, or are you working with the fire department as an EMT, the pay is all going to be different. I would say that average pay here in the Bay Area for an EMT on a non-911 ambulance is going to be roughly $20 an hour. So depending on how many hours you'd put in a day, EMTs that would work on a 911 ambulance are making somewhere between $25 to $45 an hour. And if you are working as an EMT with the fire department, fire departments are not all paid the same. So you're probably looking at somewhere right around $75,000 a year to as high as $100,000 a year. And then if you continue on and you get your paramedic license, then you're probably looking at, you know, a start of somewhere right around 75,000 to as high as 120,000 with the fire department for starting. And then benefits are going to vary. Fire departments, public municipalities, they're going to offer you more insurances and things like that. Private, you know, you probably have to pay for some of that insurance, so it kind of varies. But that's a rough.
All right. Andrew?
So for starting salary, like the panelist said, it depends on where you're at too. But in the Bay Area, it's from minimum wage. So I believe it was minimum wage is $15.40, but it was from $16 to $23 in the clinic settings. And sometimes it goes up to $30, depending on which hospital you go to in the Bay Area. But it is hard to find a job in the beginning. It's just because they're always looking for a certified medical assistant more. So that's why I chose the clinic first, because I couldn't get my certification in the beginning. It's just I have to study for it again. And normally it would take people within 3 months to obtain the certification. But once you get the certification, it should be so much easier.
Yeah. Okay, so this goes into our next question. And now this is more about the program at Foothill and DeAnza. But what is the course load like? And will the course load be doable with, for example, someone that wants to also just do like a regular major? So could you do both at the same time? Or yeah, that's the question. Go ahead, Patti.
So our dental hygiene program is part of a pilot program in the state of California, and we are able to offer a bachelor's degree in dental hygiene. So when you complete our program, you have your BS in dental hygiene degree at the end. Prior to that, it was an associate's degree. In either case, you have to complete all of your general education and prerequisite courses before you start our program. You can apply to the program while you still have a few of those courses in progress, but they have to be completed before you start the program. And the reason being is the program is full-time. You're going to school pretty much Monday through Friday. There's classes, the units vary from 15 units a quarter up to 19 units a quarter. And you're learning, you know, new clinical skills, obviously, and a lot of heavy academic courses. So you wouldn't be able to, you will have made up your mind pretty much that hygiene is the career for you if you're going to go through our program. You wouldn't be just trying it out to see if that's what you want. The selection process is pretty specific and very rigorous to get into the program. And actually working while you're in the program is discouraged as well, just because the load is so high.
Dave?
So EMR is definitely a program that you could take other classes or even work. I mean, a lot of the students that come into that are in those situations. And EMR, we get a wide range of individuals, folks that already have careers and are looking to just, you know, get a taste of emergency medical services. They may want to do search and rescue part-time. So that's doable. EMT, again, if you have a lot of work, schoolwork, then we've seen that it could jeopardize you being successful in the EMT program. There are the class hours, and then there's clinical hours that you're going to have to do within the program. And so that may, affect your work schedule, your home life schedule, but it is manageable if you're good with time management. We do get more students that go into EMR thinking, I just want to see if this is what I want to get into. EMT is that you're probably a little bit more set, that you have a career path. Now, not everybody coming into EMT is wanting to be an EMT for the reason of working in on an ambulance or wherever they want to go. We do get a lot of higher levels of medicine folks that are coming through, that they're in a holding pattern for the MCAC for med school. They're trying to get into nursing school. And so this is a good stepping stone into those other professions, because the other professions will recognize that, especially if they get some time working on ambulance, as clinical hours that they can then utilize to physician assistant, nursing, etc. Plus, physician assistants, nursing, and MDs, they don't touch upon emergency medicine in much detail. And I know multiple people who are so happy that they went through the EMT program, because if they're working in an emergency department and a patient comes in with a piece of equipment, they go, I know exactly what this is. I know exactly how we need to get it off, when the rest of the staff are all looking around like, how do you know that? And so they're able to help get the equipment off correctly. Paramedicine is a different animal. It's very similar to what Patti was talking about. You've pretty much decided that this is the career path you're going to go. So we discourage you working. We discourage you from taking a bunch of other classes. Now, we haven't quite got to the point to where you come out with an associate degree after you complete the paramedic program. But I will tell you that a third of the people that come into the program already have bachelor's degrees. Another third already have associates. And then a very small percentage that might get into the program are still working on their associates. So you can get an associate's in the paramedicine program, but the students that we see do really well in the paramedic program are ones that have already achieved a bachelor's, because they've got time management, they've got the whole workload issue down, and they do very well. Also, those folks with associates will do well. The people that struggle are the ones that put too much on their plate, both in work, both in other commitments. And so you really have to come into the paramedic program knowing, this is what I need to, this is what I want to do. I want to be successful at it. So I'm gonna have to sacrifice to make this work.
Okay, so for the workload from the medical program in DeAnza, I would say there is a big amount of book-related schoolwork that you should put a lot of hours into. Don't slack off on it, because most of the stuff you learn will reflect during your work. And there's some stuff that I wish I learned about more before graduating from the program. And I believe that the workload is doable with all the regular, with all the regular major requirements that they give you. For me, I used to study about, let's say, 3 to 6 hours a day, just studying materials over and over. For some people, it might be shorter or longer, but it is possible to pass with all A's and have a social life and have a part-time job as well. I would say that it is difficult for some people for the workload, because it is a lot for them. But I don't know how they study. But it normally would take up to 2 years to finish the medical program. If you were to take about 3 classes from the program a quarter, it took me about a year and 1/4 because I condensed all the classes together. So you're looking about 5 classes a quarter. But the program will give you like a plan out, like idea on what you should follow in order for you to like pass within that 2 years. But you can have a have an option to not follow it when I was in the program. But you you can pace yourself with the flexibility in the program on however you like. So if you're busy with, if you want to do a full-time job, you can just take about 3 classes or 2, just depending on which classes you take. For clinicals and the lectures, those are technically 2 classes. I don't know how they work it now at DeAnza, but back in my days, they have a clinical and a lecture class, so they're both separately 2 classes. Yeah.
All right. And last question before we get into breakout rooms. How has your program adapted to the pandemic? Is there an online or is there a hybrid format? And say if students want to enroll right now, would they ever get hands-on experiences?
So definitely for any of the allied health professions, you have to have hands-on experience in order to become licensed. So for hygiene, all of the lecture courses have been adapted to being virtual, online in Canvas. And then we were able to return to campus last July for our students who graduated in the class of 2020 so that they could complete their spring clinic requirements. They weren't able to be on campus at all during spring, obviously. So we were really grateful to be able to get back onto campus in order for them to finish, because they do have to have so many hours of clinical practice on working on student partners during their first year in the program. And then when they start seeing patients at the end of first year, they have so many hours that they have to complete in order to graduate from the program and then take their licensing exam. So, so we have to have a hands-on component as well.
So one thing I just wanted to add, this is directed to Patti, because many of you may not be aware. Patti, can students from both colleges come to the clinic to have their teeth cleaned or whatever?
Yes, so unfortunately for DeAnza students, we can't, you have to pay a fee. Foothill students, if you've paid your student body fees for the quarter, you can get your cleaning and your x-rays for free in the clinic. You just need to call our main clinic number, and we'll get you assigned to a student in order to have the cleaning done. For those of you from DeAnza, if you're interested in coming to the clinic, you are very welcome to come. You just would pay the $30 fee for a cleaning, and x-rays range from like $20 to $40 depending on what you needed, but definitely a lot less expensive than it would be if you went to private practice. It's at least it's like a third maybe of the cost that you would pay. But thanks, Dave, for letting me give a little shout out for the clinic.
People in the chat are like, what? That's so cool. Free teeth cleaning.
Yeah, I don't know how many people are aware of that, but it's a great, it's a beautiful clinic, and it's a great way to see what the students are doing and how they learn. And you potentially could be one of them if that's a profession you're interested in. So, so like Patti mentioned, yes, we have to do hands-on. The one stipulation that we got to the state to help us out with is that, so our EMT and paramedic students have to do so many hours in a clinical setting. And at the still to this date, students cannot go into a hospital environment. So, and our EMT students were not allowed to ride on an ambulance to get their clinicals. That recently has changed. So we flipped over to doing the whole Zoom thing for the didactic piece. And I'll tell you, for both instructors and students was extremely challenging because none of our program was online. So thank goodness for the publishers who kind of helped us out, but still, we had students that were doing face-to-face classes. All of a sudden, that's a screeching halt. Now they're being flipped into an online course. So it was very challenging. We created, in addition to the online assignments, we created face-to-face type scenarios where we would, through PowerPoint, here's your situation, here's your patient's complaint, here's a visual of the environment that you're seeing as you walk in. So we had to get really creative where we could normally do this in a classroom. So now where are we at? Well, typically we'd be offering an EMT class or an EMR class every single quarter. So that's changed. We are not offering anything that's EMS related through the rest of this year. So the first courses, the first EMS courses that, I'm sorry, let me back up. Paramedics is the only one that's being offered. But EMT, EMR has not been offered. So in winter quarter, in January, will be our first EMT class. We have suspended EMR for right now and have figured out ways of making the program more palatable, because when you went from EMR to EMT, we didn't spend a lot of time on information that you got in EMR because it was a stepping stone. We don't have that stepping stone, but we've kind of redeveloped the program to where we are able to take some of those EMR concepts to help students get better prepared for the long haul of EMT. I mean, I can go into more details within our breakout session of how that's going to be, but we'll be doing online stuff in winter and spring quarter, and we'll be doing a lab that we'll have to take all the necessary precautions of we're not really going to be doing social distancing. We're going to make sure people are very well protected on both sides, because you need to practice on people in order to get better prepared to practice on real patients. So we've kind of taken the steps to make sure people will be safe and healthy and all those considerations.
Absolutely, that's very important.
It is.
Yeah. Andrew?
So I don't know much about the program nowadays during the pandemic, but I did reach out to one of the students that is actually attending the program right now, and she said that it's definitely a hybrid class format, and there is still lecture online and with the same workload, but however, the clinical aspect, there will still be hands-on classes, but obviously student will still need a mask and a face shield. But I don't have any, and I don't have enough information to provide you guys about that. Yeah.
That's totally fine. Okay, and that ends our main session. Now we're going to start our Q&A session where you guys can ask your questions. So we're gonna first, Isabel, if you want to share your screen that has the debrief on it. So basically, Patti is going to be in breakout room number 1. Dave is going to be in breakout room number 2, and Andrew is going to be in breakout room number 3. So go ahead and rename yourself, put the number in front of your name, and Isabel is going to place you in that designated breakout room. And just know, be sure to ask your questions in the chat first, and then we can answer it from there. So we're just going to give you guys a couple minutes to just do that. Oh yeah, Isabel, by the way.
So,
oh, go ahead.
Yeah, go ahead.
Oh, no, go ahead. Go ahead.
I'm make sure you have make sure it's just the number and then space and then your name. And then I'll add you to the following room. And I'm going to open them up in a few seconds. And I've set it up so that you can actually change the room between rooms if you want to. And so if you want to ask questions to multiple panelists, you have the option of doing that. But when we tested this event out, we actually had some issues where some students could not move panels and some could. So if you are not able to, go ahead and come back to the main room, and I'll be here to redirect you to the room that you want to go to. So right now I'm going to open all the rooms. You guys go ahead and learn something new today.
Okay. 49. Where's Danny? Oh, okay, is he here? Danny, just to answer your question, we will ask the 6th question, but because of time, we'll just ask it in the breakout room. Okay.
Danny, just change your number, and then I'll go ahead and add you to. Sorry. Hi. Oh yeah. So once the event is over, it's going to load on our Zoom, and then we're going to upload it to the YouTube. So hopefully by the end of today. If not, we'll definitely send out an email if you're on our emailing list to notify you when the video is up and with the link to the video. But other than that, you can just subscribe to us on YouTube, and you get notified every time we post a video as well. So now, let me know if you have any other questions. Perfect. Thank you.